To say the last year and a half has been a challenge would be an understatement for many. With the COVID-19 pandemic alone, there have been restrictions to the usual freedoms and luxuries of everyday life, and a recent spike in cases has left people feeling uneasy. Add to it now an above-average Atlantic hurricane season, which has already seen the island being struck by Hurricane Elsa, the first such system in more than 65 years. The unpredictability of the weather is just another layer adding to, in many cases, mental fatigue. On this one-on-one, we look at mental health. What is it? How can it be dealt with? And are we sensitive enough in Barbados when it comes to this topic? Good evening, I am Lisa Lord, and I first spoke to counseling psychologist Shamar Linton, who explained in great detail everything one needs to know about the different mental disorders and why men really should speak up.
Mental illness would be something characterized as having challenges with coping and severe challenges, I should say, because there's mental health. Let's start there, like mental health and mental ill health. So mental health would be, let's say, the well-being, psychological, emotional, and social well-being of an individual. So then when you have mental illness or mental disorders, that is where the functioning of this individual is severely impacted and they're unable to function within, let's say, the regular or normal type of function that society would expect a person to function in. So that would be a layman's explanation of what, let's say, mental illness is. So the various types of mental disorders, you would have something like a neurodevelopmental disorder, I should say. So individuals who may have ADHD, something as common as ADHD, they will be registered as having a neurodevelopmental disorder because it is impacting their ability to process and to function. Their ability to concentrate is a symptom that's most notable with individuals who have ADHD. You will see a lot of these things within the Diagnostical Statistical Manual, the DSM. You will see individuals who have autism, which functions on like a spectrum. They're high functioning or low functioning because it's not like one type of individual, but they go like on a chart. So it's, they move from this side to that side, basically. Apart from the neurodevelopmental disorders, you would have something like, let's say, schizophrenia. And a lot of us know what schizophrenia is, but for individuals who might not know, let me just explain what schizophrenia is. You will have individuals who have delusions. So their thoughts, they may have certain particular thoughts that they have that is hard to move them from. They suffer from delusions, some hallucinations. Hallucinations could come in the form of auditory or visual hallucinations, more commonly with auditory hallucinations. So that kind of categorize individuals who have schizophrenia. There are people who have bipolar disorder. We know about bipolar 1, there's bipolar 2. That's more so psychosis, where individuals may experience episodes of mania, and have a manic episode where the symptoms such as, grandiose type of, let's say, personality, basically exhibiting a focus on, let's say, a particular thing, like laser focus on a particular goal or something like that. And with these different classifications and criteria, because in the DSM, there's criteria that basically you qualify for to be able to have the diagnosis. So when a mental health professional, a psychiatrist, a counseling psychologist like myself, a clinical psychologist, or neuropsychologist, so many of us, when they go through the classifications, because you have been exhibiting certain symptoms, they will see, so it could be like, for the same thing I just mentioned, somebody with bipolar, like a week or something, you're seeing this type of behavior being exhibited from an individual. And it's different from the normal behavior that they would exhibit. So you would basically tell then, because this individual is behaving abnormally. So this person is normally a quiet, reserved person, but then when they're having, let's say, an episode, you start to see they're being a bit out there, I should say, a bit at the forefront, I should say, and they could have, let's say, mood swings. So, and this is normally something that people may identify with someone with bipolar. People will loosely say, oh, well, this person has a mood swing, this person has bipolar, but not necessarily. I think that's kind of loosely saying, or dishing out a diagnosis on an individual, because it could be a good mood. It doesn't have to be, let's say, let's say anger or anything that's being displayed. I don't want to say negative emotions, because emotions have their space for every place, because they kind of indicate to us different things that are going on with us. So I don't want to say negative per se, but people tend to associate like anger and displays of outbursts in anger for someone who has, let's say, a bipolar disorder. Like they may have been quiet and then there's this outburst of anger, where it could be happiness. It's just extreme. The elevation is extreme then. So you could tell something is different about this person. And they could be, right in that for a while. And that then before or after that, you could see, let's say, depression setting in, an episode of depression as in low mood, reserve, not having interest in anything. That is normally associated too with someone who has, let's say, a bipolar disorder, like a bipolar 1 or bipolar 2. Because bipolar 2 would be an individual who, let's say, had an episode before, like prior to this. Because the bipolar 1, this is like the person now having like a first time experience with this. Bipolar 2 would be an individual who had it before, had a manic type of episode before, displayed these type of symptoms before. So that would be bipolar. So I went through, I think, neurodevelopmental, schizophrenic, which is psychosis, as I said, and there are other things amounts that. So it's not only schizophrenia that you will see in the manual under psychosis. And then, as I was saying, bipolar, so that's 3. Major depressive disorder, where you would have individuals who become, let's say, there's a sense of helplessness, hopelessness, disinterest, low moods, fatigue, feeling tired, don't want to do much, and so on. And these are symptoms that I find that a lot of people know and associate with depression. So I would say that we have been doing our job in terms of getting people aware of depression and the type of symptoms that you would associate with something like depression, and also something like anxiety. And anxiety is another major one that you would see a lot of people talking about: depression, anxiety, and then you hear a bit about bipolar, because more people are coming forward and talking about it, I would say, in my experience. So with anxiety, there's fear and worry. A lot of people, are fearful and worrying is extreme and constant. So it's constantly there. They're worrying about everything that's going on, about something happening, and their feelings of dread that are associated with, an individual who's experiencing anxiety. There are different types of anxiety: social anxiety, fear of being in social settings and things going wrong, those types of things that people are faced with. So I think, that those are a couple out of the manual, I should say, that a lot of people would associate as being a part of, society, things that they have seen and heard. And there are other OCD, and that's another one that I find people loosely say, I have OCD and this and that, but OCD is kind of attached to like anxiety, I should say. So these individuals who have OCD normally are trying to to prevent something from happening, you know. So let me put all these things in line, because if this is set off, this could cause this to happen, and it's something that's not controlled. They don't want to do it. They try to suppress it as much as they can, the behavior, but it is, you know, compulsive, you know. So they tend to do that. But yeah, that's a bit about some disorders. Going through some triggers for mental disorder. It could be hereditary in terms of it has to do with, you know, family. It doesn't have to be, but it can be. Also, it could be body chemistry in terms of how you were made up. You know, certain people also have, let's say, chemical imbalances in their brain that can be the onset of triggering the mental illness to take place. Stress being, and this is something that a lot of us are dealing with, and currently in this time too, stress is quite high. Stress and trauma, you know, trauma-related issues could be a trigger that could cause a mental disorder with individuals. So it doesn't necessarily have to be substance use. I know certain people believe that that is the sole purpose for disorders to take place, but it is not. It could be a reason, because there is a substance use disorder in the DSM by itself, or it could be comorbid where it's attached to something. It could cause it, but that's not the primary or only way an individual could, let's say, come into having a mental disorder. I would say two. There are two. And two I kind of spoke about earlier, which would be anxiety and depression. And of recent, let's say, last year at the start of the pandemic, when that happened, the cases were climbing. They were climbing, you know. So that is basically among the chief, or the highest in terms of disorders that I would have dealt with within my own practice. In terms of when individuals are going through it and the people around them, you know, and they're talking to them about it or expressing, if they're in the space for expression, because sometimes individuals are not in that space, they become withdrawn even from their social circle and their support group or system that they have built around them. I think certain individuals may be uncomfortable. So their response to someone who may be experiencing depression might be that of discomfort. Not that they're not trying to help them, but it is their own discomfort with the having to address something that is quite real. Because when someone is telling you that they're going through that, and then the stigma already being still high for this, you know, we've done a lot of work, but there's still a lot more work to do in that area. Individuals may, you know, take a step back or try to, let's say, bring it down a notch. And in some cases, yes, the individual may not be experiencing depression. Sometimes there's sadness that's involved, and a lot of sadness, I should say, but it doesn't qualify exactly as depression, because, like I said, there are different criterias that you would utilize, you know, to qualify or to say, okay, well, this person has this as an actual disorder, you know. So if an individual, let's say, for example, comes into session and they express, you know, being depressed, we go through it, because I would ask questions about how they feel, because sometimes being able to detect, you know, how you feel might be difficult. So going through, let's say, piece by piece, and you explaining how you feel, you may be able now to develop a further understanding of yourself and where you are at and what you are actually experiencing or feeling, rather than just labeling it because, you know, this thing is out there and we tend to label things to try to understand it, right? So that's what I would say in response to that. Okay, when is it time to seek help? Okay, that's a very good question. I wish more people would answer that question, but it is time to go seek help when you realize your behavior has been altered from what you grow to expect from yourself, in terms of it is tampering or hindering your functionality within society. If you're realizing you're not being able to function at work, at home, with your social groups and different things, and your emotions, the feelings that you are experiencing could be heavy or anything like that, those are times where you should seek help. If somebody's bringing it to your attention as well, in instances where you might not catch it firsthand, but somebody around you close is realizing, I'm seeing some changes in your behavior, and they decided to disclose it to you, being able to, maybe have a little check-in with yourself, ask yourself, is this so? Is this true? Am I noticing this as well? I think those are instances where you could seek help. Even individuals who may not have disorders. And I'm finding a lot more of those individuals in terms of who are on the path of self-discovery, trying to have a deeper connection and understanding of themselves prior to something going wrong. That sometimes you wait too late, or wait for something to go wrong. But then if you do that, you, in terms of seeking help or assistance to help go through or discover yourself, there are things you may learn in terms of coping mechanisms and strategies that could assist you in not going over, let's say, the barricade or the embankment, because there is mental health and there is mental ill health. In terms of, it is a continuum. You could be at this level of functioning in terms of your mental health, being able to cope with the day-to-day stressors of life and different things of that sort. Or you could be low functioning, not able to deal with the pressures of life and needing assistance. So when we talk of mental health, sometimes, we have to introduce mental ill health as well, because it's just not one standard thing where it's either yes or no. It could be your high functioning, mid, low. It depends. In terms of people coming forward, yes, you would see more women than men coming forward seeking help. There is stigma overall for mental health and mental health disorders. So you would find it a little more difficult for men to come forward. And it's partly how we have been socialized, I believe, where men are seen as more dominant and more secure within themselves and their purpose. And seeking help, meaning like you can't do it on your own and you need somebody else's assistance, is not something that it seems men are fond of, because it says something. It challenges your manhood, for the lack of a better term. It challenges your manhood, your ability to be a man, because being a man is attached to your ability to travel through and to get things done, and let's say travel through life and get things done on your own and be able to stand on your own too, to be independent and to be able to take care of individuals, rather than being the individual who needs to be taken care of. And sometimes I think it may escape us that that's a form of taking care of yourself as well, making sure that your mental health is good. So sometimes it seems as though men are limited in the emotional range that they have in terms of exploring it, not displaying it, but exploring it. And what I mean by that, being able to address how you feel, spend time with your feelings, sit and spending time with your feelings, because expressing doesn't mean that you sat and spent time with the feeling. It just means you express it, like anger, not sitting and taking time to, what made me angry? What happened there? Let me assess the situation rather than there is a response that comes. So sometimes I find, males may find difficulty in that department of expressing. So sometimes they shut down. Rather than go through it, they kind of withdraw and shut down and try to go past it, blow past it. Like, okay, well, this didn't happen, or let's forget that this happened and let's move on. And then when you leave things unaddressed, there are times where it might manifest and you might not know what is going on, where it's coming from. So being able to address it might be a little more difficult, rather than if you spent some time with it, sat with it, addressed it so that you can move forward. Earlier, I was saying that feelings and emotions are indicators, to where you are at, how you are feeling, how you, perceive and understand things, All those things are woven into what mental health is. Is when we say mental health, when we strip it right down, we're thinking and talking about your ability to process, thoughts, to understand information that's coming towards you. So if you are not, let's say, doing maintenance on that, then being able to function at your optimal level might be impacted. Therefore, you're not getting the results that you may want. Let's put it in these terms. Individuals, guys like cars. A lot of guys like cars. Constantly under the hoods. Some of them. Not all guys are into cars to that extent, but for those who are. And you're managing your system, you're doing this and making sure you do all the computer work to make sure that the engine is firing the way it is supposed to. If you don't do that, it misfires. And if it misfires, then it's not running properly, and it can impact different things and mechanisms within the same, let's say, car. So if you liken that to mental health, if you are not checking up and doing different things, then you might misfire, emotionally and whatnot. So just trying to make it a little more relatable for individuals, for men, I should say specifically. In terms of seeing the signs and being aware of the signs, there's a certain type of reality that grips you after something like a suicide takes place. Especially if this is someone closely related to the situation, right? And you tend to go through the process of what could I have done differently to have caused a different outcome. Some individuals tend to blame themselves for not being able to notice, see the signs, and provide assistance. There are times where people do see the signs, and it still happens, though they may have provided the assistance. Because it is a choice. It is a choice that is being made, by an individual. So then having to go through, because then the counseling for the family and the therapy for the family is to walk them through, being able to deal with the choice, to cope with the choice, not to be the guilt, not to have that guilt, I should say, because that guilt can be quite heavy and heavy a burden for an individual to carry. So being able to go through, the different stages with this individual that may be feeling this guilt. Because similar to grief, and that's kind of closely related because, when there's a suicide, there is grief attached to having to mourn the loss of an individual. And then there is the different stages of going through grief, and some individuals do carry guilt into it because they want so badly to change the outcome. So it's working through what has been the outcome of the situation, working through that gray area, and it looks different for different people. There are different people who may respond differently to it. So it's not a one size fits all type of situation when something like that occurs. But more often than not, you find individuals, they're guilty, they feel that sense of guilt. So helping them not to feel guilty about the situation and basically being able to, let's say, cope with and function through that process, because sometimes the functionality of a person is then limited based on the situation, the circumstances around it. If that person was, let's say, there in the space that it happened in, that's a difficult thing to have to go through. But the best thing is to go through it, because if it is suppressed, if you ignore it, then it could manifest itself in a different space, in a different way that would continue to affect the individual, let's say, adversely and not in a good way. So I would suggest that person go through that process. Relationships are a very, let's say, intimate and vulnerable space to operate in. So when they go right, when they go bad, I should say, it can be very emotionally taxing. And if you don't have the proper coping mechanisms to deal with it, there are instances where individuals can become depressed from that and have different type of mental health issues because of it. But you're speaking more so specifically to men. And then a man having a firmer grasp on his emotions, not saying it would be easy to go through that, because there's still a process. And in a relationship, that's still having to mourn a loss of relationship. It might not be death per se, but grieving the loss of a relationship. And that is a process within itself. There are individuals who may utilize substances to kind of numb the pain, which is a kind of short-term fix, which can have it could make you deficient in other areas, you know. So then being able to maybe get help if it is to that point where you may need assistance processing your feelings, because your feelings, as I said, involve. So being able to process what happened, understanding the breakup, you know, the separation, and it being the reality of a separation, you know, that is something that, you know, some men may have challenges with, but to accept, because acceptance of, okay, I have challenges with this, and going towards the direction of, okay, I may need assistance. It takes for an individual to know their strong points, their weak points. And, you know, I would, let's say, admonish men to go in the direction of, okay, well, I figured this is not my strongest area, and I may need assistance where this is concerned, and that is okay. You speak of the macho type of mentality, and as I said, that came from socializing boys and men in a particular way to kind of push past pain, to be able to, you know, hold up a good front, and it is a front, you know, in certain instances, you know, to stay strong. And that's the messages we've reinforced a lot of the time to our boys and our men, and ingrain it so much into them that there's kind of like sometimes a voice in your head. And I could speak from experience, because I am a man, that you hear, no, you have to hold firm, you have to be strong. And then you're thinking about what other people may say about you. You know, if I express them, you know, feeling bad over a loss of a relationship, how will people take this? Would they say, you know, mean things to me in terms of, well, I don't want to get into, you know, the hazing and the different things that people may say, but we all know the things that can be said in those instances are, you know, get over it. Just get over it, and not, you know, work through your feelings. Work through your feelings. Or feeling as though you don't have a support system of other men that you can go to and express, well, this just happened, you know. I'm no longer in a relationship with such and such, and I feel a type of way about it. You know, feeling as though I may not have that outlet to just talk about it. Because yeah, you can go and get help from, let's say, professional help, but there is also the support system that is necessary for an individual, support system of individuals that they know personally that can help them through the difficult spots. And being able to let's say to this individual or individuals how you may need support, and be honest and truthful about it. I may need additional, let's say, emotional support by men. Not that I need to go to a woman, not saying that there's anything wrong with if there's a woman, but saying to have and to understand that men can function within this space too, that they do have emotions and these things do happen, and they need their outlets as well. And to have, let's say, a healthy group of friends, family around you that you can share that with, that would be good. But I think we would need to reinforce different messages now, you know, because having those messages over the years, reinforce, as I said, ingrained into us, then doing it on the opposite end. It's okay to feel sad. It's okay to cry as a man. It is okay, because it's you said release. It's a part of a release. Sometimes when you have a good cry, feel a little better, you know? because is a physiological response to something, that has happened. It could be tears of joy, it could be tears of pain, which we're talking about. So for man to have, because at the end of the day, yes, we made distinctions between men and women, but you're a human being and we function in particular ways. So you being able to have an emotional release can go a long way for you as a man in functioning as well. So it's not something that's only good for women per se, but as a man being a human, you still would need that for you to assist you through it, rather than going and doing something else that might not be as, let's say, productive or assist you through the process you're going through. Where would I like to see Barbadians in terms of mental health and stigma? That's a very good question. I would like to see, I will say, continuation of, because there are people who are out there advocating for mental health. There are a lot more people who are interested or understanding of mental health and the benefits of taking care of one's mental health. So I would like to see, more resources pulled in the direction of mental health, more understanding, because there's still a stigma. I wouldn't say that there is no stigma. There's still a lot that we're dealing with. More education and more knowledge, let's say, of these things, rather than a fear and withdrawing from them, trying to understand them as best as you can and going in spaces or places where it has the information that you could utilize to better understand this, because there are a lot of individuals amongst us who may have mental ill health or mental disorders. And you might not know. And you may treat the person normally, So being able to empathize and treat people with respect and with dignity and an understanding of what they may be going through. Because everyone has challenges. Everyone may have their challenges. And being, let's say, your brother's keeper, this is something that we preach as within our society, within our culture. This is who we are. We've been saying that. So let that be something that is cross-applied in the area of mental health. Like how we talk about cancer and how, and I like what has happened with that cancer and, let's say, HIV and AIDS, how far we've come with those situations and those diagnoses that people may have when they have those health challenges, and how we tend to represent them and push for, better treatment and for a better understanding and whatnot. So having that in the area of mental health as well, because this, we're talking about our minds and being mentally healthy, because if you have a healthy mind in your body, it can translate as well, because the two go together, not one without the other. It's in order for me to move my hand, messages are sent. So understanding it from that perspective rather than something to shy away from or to push to a corner. So giving it the space that it needs, for the discussions and for improvements to be made. So I hope I didn't ramble on, but those are things that I would like to see continued, because I don't want to say that it is not happening. And also for more people to seek help. I would love to see that. For more people to seek help, so that they could be better and feel better, about themselves and whatnot, and maybe model that to other people, model that behavior of, why I took that step, and encourage other people to do so, for themselves and for others. So that is what I will say on that.
We will take a break here and come back with more on the topic of mental health. This is One on One.
Hello, I'm Dr. Ingrid Burrows, and I'm going to give you some tips on managing your hypertension. The first thing you should do is to decrease your salt intake. You should keep your salt intake to less than 1 gram a day. This is equivalent to about 1 teaspoon of salt every day. Another thing you should do is to ensure that you're getting enough physical activity. You should aim for 150 minutes of aerobic exercise every week of moderate intensity. For example, brisk walking, light jogging, swimming, or running. This equates to half an hour of exercise 5 days a week. You also want to increase your intake of fresh fruits and vegetables. It is advised that you eat 5 servings of fruit and vegetable every day. And the last thing you can do is monitor your blood pressure at home with a digital machine. This is very important as some patients have elevated blood pressures while in the doctor's office while having normal blood pressures at home. This is called white coat hypertension. Also, if you're taking medication for your hypertension and you notice any changes in your blood pressure, you can call your doctor and he or she can adjust your medications to suit. If your readings are too high or too low, you can inform your doctor and he or she can adjust your medications appropriately. I hope these tips have been helpful.
Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another against depression. Develop emergency community plans so that we could function. Remove outdoor objects. Make sure that you went to the ATM. Stock up with water. Make sure you clean the guttering, Lord. What about canned food? Make sure you got some stock up in your room. Make sure you prop up the paling and tie down the roof. Let me start to prepare real soon. Let me begin preparations. It's hurricane season. Let me sit down and reason. Let me secure a nation. Know your shelters, Bajan. Help out one another against depression. Develop emergency community plans so that we could function.
Welcome back. Clinical psychologist, clinical hypnotherapist Krishnan Hurdle also shared his perspective on mental health and how people can start the healing process.
Mental health is one of those things that we have associated with persons being mad and crazy. And it's very, very important that we recognize, especially the onset of COVID and this pandemic, that mental health affects us in several ways. And so the idea of the stigma of mental health is not about persons who have these, what we referred to earlier as psychotic disorders, where they lose in touch with reality, but where you're stressed out, where you're overworked, you're burnt out, you are having difficulty sleeping, you're having anxiety, you're having difficulty thinking on the job. Stigma is real. Persons have certain connotations and associations with mental health and seeking out mental health services. But really, I work with from a family of a parliamentary representative to executives. I've worked with CEOs, general managers. I've worked with teachers. I've worked with other mental health professionals, and I've worked with children. So it doesn't have to be, so we must get away from the idea of mental illness and really look at how healthy am I doing? How am I functioning? How am I thinking? How am I doing emotionally? When people think about mental illness, we usually talk about people who are what we refer to as mad or gone off. Of course, we don't like to refer to that. We give them their technical name, psychotic or schizophrenic. And this is where the person has lost touch with reality, where they may be hearing voices, or they may be thinking that what people are doing to them might be affecting them in some way, but it is not. It's what we refer to as a delusion or a hallucination. Either they're hearing something or they're having an interpretation of what is going on around them that might not fit in with reality. Their anxiety disorders, most of us hear about PTSD, panic attacks, maybe related to phobias, agoraphobia, going outside, fear of specific things, specific phobias. And then there's general anxiety, and persons may also have things like performance anxiety when they got to play a sport or whether they're in front of a camera or performing our exams. And then there are some disorders that are related to old age. So we're thinking of like, not necessarily old age, but diminishing in the brain, like dementia, where persons tend to lose their memory and they're not able to be able to be in tune with the world as they're accustomed doing. There's depression, or depressive disorders, I should say. There's a range of those. Depressive disorders include things like major depression, where persons are unable to do the things which they're unmotivated to function, to do the things which they're accustomed to. They may be sleeping for long periods of time. They are not able to interact with the world as they used to. They tend to feel sad. They're crying, perhaps crying a lot. They are feeling like their life is hopeless. And many times with depression, people tend to feel suicidal. That's something that we probably look at. And just tend to be down feelings and not motivated to do things, and losing pleasure as well, losing pleasure for things that they're accustomed doing. You can also have issues with sleep, because there are also sleep disorders, but some tend to have issues with sleep as well as eating changes as well, diet changes. And then, of course, there are, as we mentioned, sleep disorders, insomnia, where persons struggle to get to sleep. They might be struggling to get to sleep. They might be struggling to waking up during the night and not being able to get back to sleep. There may be things like sleep paralysis, where they're having unable to move coming out of sleep or as they wake up. And then there are other childhood or developmental disorders like autism, Asperger's, where there's a defect in the brain, maybe because of birth or other events and early childhood events, and they're unable to interact as we say, within normal range as we are accustomed to knowing. So those are some of the range of mental disorders that we see on a regular basis. Any age group can be affected. So there are children, because we see mental disorders in very early development. And then you can go all the way up to, as we mentioned before, things like Alzheimer's and dementia into the latter years. When is a good time to see a psychologist? When you feel like you're overwhelmed, when you feel like you're not able to function in a way that is helping you to get through your day's activities, whether it is work, interacting with your family. So overwhelm could be anxiety. Overwhelm could be you are so high and so happy, and we're thinking of things like bipolar disorder and mood disorders. Or you're so low and depressed and you just can't function. Stress is one of those things that is a trigger or risk factor for many other situations. So whether you're overworked, whether you feel like you are unable to think clearly, you're having anxiety, whether it's panic attacks, or you're having the inability to some people have difficulty getting to work, or while they're at work, they're unable to function on the job. You're finding that you're having difficulty remembering things, or you just tend to be kind of foggy. Brain fog is something that affects people a lot, especially related to insomnia and some of the mental disorders specifically. But when you feel like you're overwhelmed, you're not able to function, do your regular day's activities, that's the time where you should really reach out for help. You can reach out on the behalf of someone else. So if you find that a family member is not functioning well, you can reach out, you can call psychiatric hospital or call one of the a therapist and reach out for help on their behalf. Of course, they must be willing to do it, but you can get the ball rolling. First of all, when a person is a harm to themselves or harm to someone else, that's the first stage of, the first sign that they need to be institutionalized. Whether it's health harm, cutting, beating themselves up, they might be threatening to commit suicide, so suicide thoughts, suicide ideations, suicide plans. And then, of course, if a person is a threat to someone else, whether they are threatening to harm someone else, of course, you can call the police or call the assessment unit at the psychiatric hospital to have some kind of intervention, or a community mental health officer. For the most part, the public is encouraged to contact the police if a person is a harm to someone else. They can also call the ambulance service for someone who is a harm to themselves, whether they want to commit suicide or they're self-harming. But we tend to first of all think of the police and the psychiatric hospital as the first steps of intervention. But if you want immediate advice, of course, you can speak to a mental health practitioner, a qualified mental health person, and they can advise accordingly. I am really, really proud and really, really honored when I have the opportunity to work with a man, with a male. It's very, very heartening that either he thinks he wants help and he's reaching out for help, or someone in his family has suggested it. Now, of course, in the process, the person will decide, do I want to continue this or do I not want to continue? But most of the time, there's a lot of ego involved with men and mental health issues. And there's the whole idea of feeling like you're weak and being vulnerable. Because that sense of ego tends to be so much stronger with men. And you tend not to want to see yourself as an very emotional person. There are the connotations of emotional being a weakness. Then they tend to avoid dealing with their feelings. They tend to avoid dealing with their past traumas, their past disappointments and failures. And that tends to cause them to go in a rut where they're not handling their situation well, where they're resorting to alcoholism and dependency, drug dependency, and even violence. Because a lot of the emotions are being kept inside, they're not expressing them in healthy ways, and then they're choosing dysfunctional or deviant ways of expressing their emotions or just responding. Many times persons are at a stage where they can't control, they're responding, and then sometimes they go over a threshold where they're just reacting and responding automatically. So I always do encourage men to reach out for help. You're not weak if you're reaching out for help. In fact, the ability to pass a vulnerable stage is a point of strength. And I like to say to my men when I'm working with them, the ability to just like sports, when you have to push and you work out and you're going through certain thresholds to reach that point of physical strength, to go through and push through these vulnerabilities and these difficult feelings actually requires you to be strong. And the first point of strength is vulnerability, whether you're submitting yourself to a trainer, you're submitting yourself to a coach, or you're submitting yourself to working alongside a mental health professional. It really is about strength. It really is about realizing that you are struggling and you need help, and that help is available to you. So see yourself as strong. Realize that there's a strength that comes from challenging your vulnerability. I think that the behaviors we are seeing nowadays definitely come from that point of not seeking help early enough. Many times there are indicators, and in early stages, persons are not paying attention to those indicators. Whether it is anger building up, it is the feeling of burnout, you're snapping at your family members, you are struggling, you're having difficulty sleeping. In some cases, it starts with waking up and not being able to get back to sleep. Other cases, you're struggling to get to sleep in the first instance. Or there is the issue where you tend to feel like I am dealing with it my own way. And when they feel like they're dealing with it their own way, oftentimes they're really not doing anything. They're using that as an excuse to avoid getting help, to avoid reaching out for help. And then it builds up. And in some cases, it becomes a real significant disorder, severe disorder. In other cases, it leads to some kind of dysfunctional behavior, whether it's alcoholism or drug dependency or even domestic violence. I am aware that within our homes, within our schools, even within the mental health fraternity, most of our practitioners, most of our leaders are women. And, we tend to wonder sometimes, I think about the impact of the impact of growing up, being led and being trained and being socialized by a female-dominated society in some cases, or female-dominated organizations. And while this is not a conversation about feminism or that those things, those issues, I definitely am concerned about the absence of men within our institutions. I'm concerned about the absence of men within our places of influence, whether it is the schools, whether it is our homes, or our mental health settings. And we definitely ought to encourage our women, definitely ought to encourage our men to be more involved. Even if there isn't one in the household, you can always try to kind of pull in or direct your young man to your son, your nephew, whatever the case is, to some kind of positive male influence. And additionally, I definitely would encourage all of us to not see mental health as, once again, as an illness, but to see it as a degree of wellness, where we are considering how well are we able to function, and how can we perhaps manage our conditions, manage our minds, our emotions, our thoughts, and even our behavior a lot better.
Hi, I'm Dr. Adana Grandison, and I'm here to give you a few tips on how to accurately and safely take your blood pressure readings at home. Before taking your measurement, sit in a calm, warm environment. Don't perform any exercise in the preceding 1 hour. No coffee, food, smoking, or even sinus medication in the preceding hour to taking that blood pressure reading. Empty your bladder and bowel. Most readings that are taken at home should be below or at 135 on 85 millimeters of mercury for uncomplicated hypertension. Lower home blood pressure targets might be advisable in persons who have the following conditions: diabetes, chronic renal disease, or coronary heart disease. If several readings are above 140 on 90 millimeters of mercury, make an appointment with your physician immediately. Ensure to take your readings at the same time every day. We advise 2 readings in the morning and 2 readings in the evening, initially to profile yourself, taken 1 to 2 minutes apart. However, once you have established a baseline, you can choose a time suitable to your schedule where you can monitor your blood pressure readings.
So you heard from a clinical psychologist, clinical hypnotherapist, and a counseling psychologist on the signs one should look for not only in themselves but in their loved ones. Don't take anything for granted when you don't feel like yourself. Don't self-diagnose and put it down to stress, but instead seek some professional help. I am Lisa Lord, and this was One on One.